everyone, and welcome. So today we're going to be diving into the complexities of assessment and recreational therapy service delivery. So I am Lindsay Welch, again, certified therapeutic recreation specialist, and this lecture kicks off week one of our exploration of the APIED process, which is the foundational model for guiding recreational therapy practice. So, what is recreational therapy? So, when we're talking about that, therapeutic recreation is the field and recreational therapy is the practice. So, recreational therapists are the practitioners. So, the CTRS, which you're all working towards, the certified therapeutic recreation specialist, is a qualified provider. The recreation therapist assists clients to achieve health protection and health promotion through the RT process. And the recreational therapist employs purposeful, goal-directed interventions that involve clients and activities that have the potential to produce recreational and leisure experiences that lead them to experiencing the optimal levels of health for them as individuals. So this might vary. So for some clients, reaching the optimal level of health may mean restoring health to what was normal for the individual prior to an illness. For others, it might just mean adaptively coping with chronic conditions. And then for others, it may mean improving health so they can enjoy a high level of wellness. So in order to accomplish these ends, the recreational therapists have to employ the systematic four-step process termed the recreational therapy process. So remember, recreation therapy is not just fun and games. It's a structured, goal-oriented process that empowers individuals by enhancing their functional abilities, promoting meaningful engagement, and supporting recovery or maintenance of health. So we're going to talk about more what that means in the next slide as we get into the APIED process. So API or APIED is a systematic process used by healthcare professionals. So the therapeutic recreation, for therapeutic recreation, this includes physical, mental, social, emotional, and spiritual domains in this process. So it is client-centered to meet the unique needs of the client. It is cyclical, so you can see it's going around in the circle. All phases interrelate, and it is goal-oriented. So when you are working, you are always working to achieve a goal when you're working with a patient or individual. It is collaborative in that it requires a therapist to communicate with the client to meet his or her needs. So that might mean including somebody else in that process, sometimes too, another therapist, but it's always collaborative. It emphasizes feedback to reassess the problem or revise an intervention plan, and it is applicable as a framework in all recreation therapy or therapeutic recreation settings. So when talking about APIED, the reasons why this process is important is a few things. Number one, it provides a problem-solving structure to accomplish the delivery of effective and customized care. It involves orderly step-by-step actions directed to achieve stated goals, and it promotes customized care by providing a system to meet specific, unique client needs. This process involves tailoring interventions directed to the individual, not the disease or disability. It supports an increase in client participation and care by collaboration between the client and recreational therapists during each phase of the recreation therapy process. And it offers an efficient, systematic approach where the focus is always on the client. This allows for the delivery of care that is organized, continuous, and systematic, which leads to a goal-directed approach and outcomes that may be reached through RT interventions. This ensures accountability by including the evaluation of sought outcomes. And though it's a cyclical nature, it establishes the interrelationships among and between its phases, which ensures all of its parts were working together. So everything's in a circle, but everything, so documentation, it's going to work with assessment, it's going to work with planning, and so on. This provides a systematic and logical sequence through which recreational therapists can apply knowledge, skills, and critically think to deliver quality care. And this framework can also be university applied, as a framework in all settings in which RTs work. So this can be across the board, from inpatient rehab to skilled nursing to community recreation, however you want to cater it. It offers a means to interpret to others how recreation therapy can contribute to client care. So diving more into each of these individual parts. The first process is RT assessment. It's probably the most critical step in the process. So you're going to be working with clients to identify health status, needs, and strengths to provide data for interventions, gathering information with and about an individual to discover their dreams and goals and how functioning can be improved. The assessment provides the basis for meaningful recreation therapy interventions. So assessment is a process and not a one-time event. This includes a lot of different components. So that may be medical history review, consultation with other care team members, the administration of a valid and reliable assessment instrument for the condition, population, or area in which the practitioner requires insight. This might involve interviews with a client or family, client observations, and evaluation of resources that are available in the community. So some different areas of assessment identified by the NCTRC are sensory, cognitive, social, physical, affective, leisure, and functional skills. So really the goal of the assessment process is to understand the strengths, needs, and preferences, which will guide our treatment planning. So again, the different areas of assessment that are identified by the NCTRC are these different domains here: sensory, cognitive, social, physical, affective, leisure, and functional skills. These areas ensure that our assessment is holistic and not just focusing on what's wrong, but what's meaningful to motivating the client to be the best that they can be. So once we're through the assessment phase, priorities are set and goals are formulated, objectives are developed, program strategies and approaches are specified, the means of evaluation are determined, goal setting and creating an individualized plan focused on learning, adapted, and growing are formed. So that's when we are going to be making our individualized treatment plan. This is going to have all those measurable goals and specific evidence-based interventions. So again, this planning is collaborative and client-centered. So a lot of times you're going to actually be working with your client or with the team that the client works with or the patient in order to come up with the most effective plan for them. It's always rooted in strengths and the preferences of the client that you're working with. So next is the implementation phase. So that's when we're going to put our plan into action. So that is when the interventions are going to take place, whether it's the therapeutic arts, adaptive sports, community integration, activities, stress reducing. Implementation requires flexibility, clinical reasoning, and strong facilitation skills. We continually monitor progress and adapt as needed. So in this phase, again, you're going to be taking whatever you based on assessed, based on planned, and then implemented. And again, you're going to be constantly evolving and or changing these different interventions that you're implementing as needed. So next, evaluation. So we're going to be talking about the goals and objectives again. How are they evaluated? How did the client respond to the planned intervention? So that's when you're going to be reviewing the individual's progress to see if they're reaching their goals and their dreams and, whatever they wanted to do. So this includes assessment summaries. Sometimes that includes treatment plans or progress notes, discharge summaries, and communication with the entire team that you're going to be working with that particular patient. Documentation must be clear, objective, and timely to support continuity of care and to protect both the client and the practitioner. So then documentation. So this is the last phase. It's going to be, again, just document everything, and that as it relates to the client, kind of go back to your assessment and your goals and figure out, where that all went. So this week our focus is on building that strong foundation in the assessment phase of APIED. So as we move forward, we're going to explore how the information you gather at this stage sets the tone for the successful intervention and meaningful client outcomes. So keeping in mind that recreation therapy is not just about the activity, it's about purposeful and therapeutic engagement that makes a real difference in people's lives. So thank you all, and I look forward to guiding you through this process. As always, if you have any questions throughout the week, comments or concerns, please feel free to reach out to me, and I'm happy to help. Thank you all so much. Have a great week. Bye.